I was just talking to my friend, Dr. Erin, who's a pediatric dentist, and we wanted to do this very quick live with you. So she's going to join me any second now. And we wanted to talk about basically what to do with your kids, like when to take them to the dentist, what products to use, what toothpaste, what toothbrush, all of that fun stuff. So just waiting for Dr. Erin to join us here. So if you guys have any questions, this is going to be quite a quick live. I want you guys to put whatever questions you have. Welcome, Dr. Erin. Any second now when Instagram wants to allow her to actually join. So I'll get started here while she's joining. Hello, how are you?
Good. How are you?
Good. Okay, so give us a couple tips on how to keep your kids cavity free. Specifically, what products to use, when to take your kid to for their first appointment, and then also I was thinking about your take on fluoride in kids' toothpaste
Okay.
and flossing and how important it really is for those baby teeth.
Perfect. So let's start with when to start seeing the dentist. The most important thing is to start early as far as taking your kids to a dentist. And preferably you're going to want to see a pediatric dentist because trust me, most general dentists or even family dentists are not going to want to see a
Yeah.
little baby in their office for many reasons. But at age 1 is the actual recommendation, age 1 or within 6 months of first teeth coming in. So about age 1 is when we want kids to start seeing a dentist. They may or may not have many teeth, but the teeth that they do have, we want to check on those. Because cavities can happen at any age. For some reason, a lot of people think like cavities can't happen till older, but literally the moment teeth come in, the bacteria that causes cavities like hard substances. So that bacteria will latch onto the teeth. But nonetheless, we're checking teeth, we're checking the growth of our jaws, we're checking how our palate looks, the gums, we're checking if there's any type of restrictions like tongue ties, lip ties, and we're just getting them used to coming to the dentist. And moreover, honestly, these first visits are a lot for the parents to learn how to take care of their teeth, a lot of what we'll talk about here, but how to take care of kids' teeth, what products to use, what to look out for at certain ages, how to protect the teeth, all of that stuff. So it's just as important for the parents as for the kids.
Yep. I'm glad you said that because I think some people are like, what are they going to do? Like they don't even they have one tooth, right? Why am I
Mhm.
taking them to the dentist? But it's not a waste of time because they're
Yeah,
checking for their development too. And they're
exactly.
giving you specific individualized things that you should be doing and looking out for
Exactly.
specifically for like the way your kid's enamel is appearing, way that they're functioning, all those types of things. Okay, so um,
I literally saw a kid today who has half of a tooth in. One little baby tooth there. Like
yeah,
that's it.
I
So
know, but you
cute.
could
But like
see like
parents are
the jaw development and all of that and talk about like what to eat and what not to
exactly.
eat and all those things. And it's
Exactly.
so individualized to each kid and every kid's teeth are so different. And so like you need to know what to do with your child so
Exactly.
that when they're older, they're not seeing someone like me for a whole bunch of dental work that could have been prevented, or you're not putting them at risk for having developmental issues where then they get to somebody like me and now it's so much harder. So let's talk a
Exactly.
little bit about fluoride usage.
Mhm.
Thoughts?
Yeah. So I know there's a lot of thoughts out there, and I'm very open, but I personally do like fluoride and
Same.
toothpaste and
Same.
mouthwash and things like that.
Yep.
I recommend it to my patients and their families. Now, if someone has strong opinions and feelings about it and like absolutely does not want to use it, I'm not going to force it on them.
Yep.
There are options like nanohydroxyapatite, things like that, but it works a little bit differently than fluoride. And personally, in kids at least, I can't speak to adults, I don't see it working quite as well. This is just what I'm seeing as fluoride as far as prevention and
Yeah.
strengthening the teeth.
I'm a
But
big
again,
fan of fluoride too.
yeah,
Yeah.
yeah, yeah. I think it's great when you use it in the right amounts. It's
Yeah.
just like anything.
Can
You
we
can
just
literally
say,
get
like, fluoride is dangerous when you ingest
yes,
large amounts of it?
correct,
It's not
correct.
like
Like
even
eating.
water is dangerous when you're consuming large amounts of
That's
it.
what's just about
But as a
to say.
topical
Water.
agent for your teeth, yeah, it's not harmful. It's not
Yep,
toxic. Um,
yep.
just like olive oil is not toxic unless you heat it too high, right? And then the properties
True,
of it change, and then it's different.
true.
So let's move on to the last and final thing, which
Mhm.
is what about flossing for those baby teeth?
Yes.
How much does that
So
aid in preventing decay?
so important. And again, flossing is not age based. If teeth are close together, touching, overlapping, you floss your kids. Use those
Yeah,
little flossers and get in between them. Because the thing is, brushing can only do so much. It can't get in between where teeth touch. And we all know how little ones and toddlers are with brushing. You get maybe 10 seconds or so. So you're probably not even getting all of the tooth surfaces that toothbrushes normally get, but then the floss is going to get in between to get any food, bacteria, sugars, leftovers out from in between those teeth, especially in between back
yeah,
teeth where teeth usually touch for most kids. Because if you get a cavity kind of on one side of the tooth and then the tooth touching it is right there, that cavity is going to
yep.
spread and you go from like
Nice.
0 to 2 to 4 to 6
Yeah,
cavities
yep,
like
yep.
that.
So
Mm-hmm.
fast. Yeah.
So,
Okay,
yep.
great. So that was so helpful. If you guys have more questions, please reach out to Dr. Aaron or leave them in the comments below. Also send us messages because we're going to do more of these. And
Yeah.
see you guys all soon. Take care.